Come in.
Hey, my name is Jennifer. I'm going to be your nursing student today. Your doctor has ordered a full head to toe assessment. Is it okay if I do that assessment on you?
It is.
May I touch you?
Yes, ma'am.
Okay. Can you verify your name and date of birth for me?
Shanna Dupree, 10/20/1982.
Okay. I'm going to check your wristband. 10/20/1982. Okay. We got the right patient. Can you tell me where you're at?
I'm in Cochrane
Okay.
at Jennifer's house.
And what are you doing here?
I am helping you to get an assessment done.
Okay. And what year is it?
2022.
Okay, my patient is conscious and alert and oriented ×4 to person, place, time, situation, or event. She is answering my questions appropriately, so there's no speech deformity. She's making eye contact with me, so there's no eye issues. Let me make sure that was all there is. I think there is. Now I'm going to inspect your head. We're going to go head to toe. I'm going to start with your head. I'm going to palpate your head. I don't see any deformities. I also don't see any thinning of hair or irregular patches that would show some kind of hair issue, hair loss issue. Your face is symmetrical. Nose is midline. Trachea is midline. Your ears and eyes are symmetrical, and from here to here is correct. Width, length. I don't see any wax coming out of your external ears. Do you have any head pain?
I have a headache on the back of my neck.
Okay. Do you wear glasses or contacts?
Only for reading.
Okay.
Glasses, no contacts.
Alrighty. And do you have any trouble swallowing?
I do not.
All right. Can you swallow for me? All right. That was normal. Do you have any nosebleeds?
No.
Okay. I'm going to check for nose patency. So if you'll put your finger up to one side of your nostril and breathe in and do the other one. All right. I didn't note any abnormalities. Your mouth. Do you have any problems with your tongue or swelling or teeth? Any of that? Okay. All right. It's pink mucosa. Teeth are shiny and white. I didn't note anything abnormal there. Your lips are moist. I don't see any cracks. All right. Head, ears, eyes, nose, throat. Neck. All right. If you could turn your head to the left. Now to the right. Okay. Neck moves correctly. And I don't see any jugular vein distension on either side. All righty. Now for the respiratory assessment. I'm going to also take your breath sounds, and when I move the stethoscope, if you would, take a deep breath in for me.
Okay.
All right, second intercostal space. Right upper. Left upper. Okay, now if you're taking, put your shoulder, your hand to your shoulder. And I forgot to say right lower, left lower. This will be the right middle lobe. And now the other arm. And that would be right lower lobe. All right, I'm gonna do the back. So I did the anterior, lateral, now I'm doing the posterior. Left upper, right upper, right lower, left lower. Okay, no adventitious sounds noted. Respiratory. Okay, I'm going to teach you 2 exercises. Turn, cough, and deep breathe. This will just help move the mucus in your lungs, and so that way you wouldn't be prone to pneumonia.
Okay.
So if you could, turn your head to the left or the right. Take a deep breath and cough. Okay? And I would ask that you do this every 2 hours. Okay? The other one is the incentive spirometer, and I'm going to act like this is an incentive spirometer. So do you know how to use an incentive spirometer?
I do.
Okay, so this is a test to help with your lung function. And we're going to set your goal, and we just ask that you try as hard as you can to meet that goal. So if you could demonstrate that for me real quick. All right. I would also ask that you do this 10 times an hour, so during commercial breaks.
Okay.
And again, that's for your lung function to help with that. All right, respiratory. Check for cap refills, and then I think I'll be done with respiratory. Yep. Cap refill is less than 2 seconds. All right, now the heart. I'm going to listen to your heart, different places of your heart. You don't have to take a deep breath. Aortic. Pulmonary. Erb's point. Tricuspid. And then under the fifth intercostal, mitral valve. And to hear any murmurs, I would turn my stethoscope to the bell and listen to those same locations to hear for heart murmur. S1, 2, 3, or 4. Okay, edema, cardiac. So we're going to check for edema. I don't see any edema. Let me check your feet. Lower legs, no edema noted. Alrighty, no edema noted. Cardiac, we did the heart sounds. All right, do you have any problems breathing?
No.
Do you have any chest pains?
I do not have chest pains. I do have PVCs.
Okay, that's cool. Can I hear that with the bell?
Possibly.
All right, I gotta hear this.
If it does one. They're doing it about every 30, 45 seconds right now.
That sounded normal.
Yeah, it was.
It was.
I didn't feel one during that time. It's
was
random,
normal.
so
Exactly.
I'm on metoprolol 25 to help with those.
Okay. Good to know. I will document that. Cardiac. I think I asked everything in cardiac. Got refills, edema. Listen to the heart sounds. Asked a question. Okay. Now to the neuro. I've already asked if you're conscious, alert, and orient times 4. So I'm going to ask about or tell you about the Glasgow Coma Scale. Mm-hmm. So the Glasgow Coma Scale is for head trauma. Have you ever had head trauma?
I have not.
Okay. So we would assess your eye opening, your verbal, and your motor. And depending on where you scored, and that would depend on your head trauma.
Okay.
Musculoskeletal. Do you have any issues with your joints or pain in your arms or legs?
No, but I went to the chiropractor this week, and they did an X-ray for lower, buttock pain,
Mm-hmm.
and found out at some point I've broken the tip off my tailbone.
Oh my!
True story.
Wow! Oh goodness!
That's causing my pain.
Well, that would explain your pain. Okay, so I'm gonna assess some range of motion and your joints of your 2 upper extremities and 2 lower extremities.
Okay.
And so, if you could, let's do your neck. So, can you turn it right and left? All right. And now tilt your head front and go backwards as far as you can go. All right. Range of motion is normal. I didn't see any deformities. Now I'm going to do it to resistance.
Okay.
All right. You can go all the way back for me. All right. And then all the way forward for me. All right. Now to the side. And the other side. All right, I didn't hear or feel any crepitus. All right, let's do your elbow. All right, if you could, that's extend. So if you could flex it and extend again. Now we're going to do it to resistance. All right, so extend or flex. All right, and then extend. I didn't hear. And I would do that bilaterally on both arms. All right, now for your lower extremity, we're going to do your knees.
Okay.
You already have them extended, so we're just going to have you, we're going to do that flex. So out and then back in. Now to resistance, back in. I did hear some crepitus, or feel some crepitus. All right, to the other one. Yeah, I heard a pop or two. Alrighty, and then we're going to do your ankle joint.
Okay.
So if you could, point your toes, and I'll point them down to the ground, and then side to side. Alright, now the other foot, up, down, side to side. Now to some resistance. Alright, go up, now go down, and then side to side. Okay. Let's go up. All right, go down and side to side. All right, didn't hear no crepitus in that. You didn't say you're having any pain or anything. I forgot the abdomen, so I'll go back to the abdomen. So for the sake of this video, I would normally have the patient lay down flat and have the shirt up to where I could listen to the sounds without clothing. Do you have any abdominal pain?
No.
Okay. Do you have any problems urinating or with bowel movements?
No.
Okay. Are your bowel movements normal, or how often do you have them?
Frequently, but I have no gallbladder.
Okay.
So
that would be why.
Loose stool is a normal occurrence.
Yes. Okay. And when you urinate, is your urine, what color is it?
Yellow.
Okay.
Light yellow.
Alrighty. So with the abdominal assessment, I would assess right lower quadrant first, then go up to right upper, move to the left lower, down to the left upper, left lower. And I would do the same thing for palpate. I would do right lower, right upper, left lower. And then I would auscultate for, with the bell, for an aortic aneurysm, and I would listen here. I did not hear any brute sound. Let me think. Abdomen, I asked the patient question. All right, I think I've done everything. Can I look over that list?
Yes.
Just to make sure. Skin. Oh, didn't do your skin. Head, ears, eyes, nose, throat. Respiratory, cardiac. Oh, gotta go back to the. All right. So one thing I forgot on the cardiac was we have multiple places for pulses. So we have the carotid, the axillary, the brachial, the radial, and I will assess if this is bilateral. Yes, we're 2+. We have the popliteal. We have the dorsalis pedis, and we have a pulse right here, and it would be bilateral. And then we have the posterior tibial pulse back here behind the ankle. So we would assess the radial, the popliteal, and the dorsalis pedis pulse. No, I'm sorry, not the popliteal. The posterior tibial and the dorsalis pedis pulse bilaterally. And then the skin. Skin turgor appears the skin appears normal for ethnicity. Skin turgor is normal. And we'd also check it here at the neck. Do you have any issues with your skin? Any kind of dryness, rashes? Okay. I think that is all that I'm supposed to do. Okay. Well, I will give these results to your doctor, and he'll be with you momentarily.
Okay.